took over as the commander of the Fairfield-Hocking-Athens Major Crimes Unit a couple years ago, and our primary role and mission was drug enforcement. And having been somebody that's been involved in drug enforcement for more than 30 years now here in the state of Ohio, the challenges that we face in a community like ours, they're much different than they were in the past. And so thinking about our approach, which is important, and it's a piece of what I think every community needs in terms of battling these very challenging issues, I thought we really need to look at some progressive approaches. So we were able to form a very strong community partnership and coalition with stakeholders across Fairfield County and talk about ways that law enforcement, specifically the Major Crimes Unit through drug enforcement, could approach this issue with a different mindset. And that mindset really being what is at its core a pre-arrest diversion program. So, looking at what our tools were in the enforcement world, typically we would be out arresting folks for low-level trafficking offenses or other criminal offenses. And those low-level felonies, there wasn't a tremendous amount of sanction that we saw occurring within the communities where those people were removed. But we thought another approach might be to try to connect them with available community resources with respect to treatment, prevention, detox, education. And so collectively, all of these stakeholders came together and were able to create what has become Project F.O.R.T. So in our community is someone overdoses and survives that overdose event, or they express through a family member or come in contact with law enforcement that they're interested in recovery or treatment options. A Major Crimes Unit detective working with a community paramedic and a peer supporter or a peer recovery coach goes out, meets with that person and their family or their support system, and connects them to available resources in our community. We definitely faced a lot of challenges. So the way that I look at it and talk about it, I kind of call them cultural belief systems that exist within these disciplines, whether it's law enforcement or even in the treatment and prevention world, the medical field. People that kind of look at folks that have these substance abuse disorders and just say, let's lock them up and throw them away. They're not, we really don't see value in them in our society. And we came together and recognized that maybe this different approach by offering these people an opportunity and providing the support and identifying the parts of the process, if you will, that people tend to fall through the cracks. I think sometimes people, they get an opportunity for treatment or recovery. They want to take advantage of that, but there's not bed space, or the outpatient programs can't take them right away. And so there's this lag in getting them into the system. So our coalition really worked at trying to identify how to prevent those things from occurring. So in our system, whether they connect through an overdose event or through a contact with a law enforcement officer, we immediately identify what are their specific needs. Because although they all share this common thing of the disease of addiction or substance abuse disorders or some mental health disorder that's underlying, they're all individuals and they have individual needs. Some of them, their needs are immediate in terms of how am I going to pay my electric bill? Because we know if they can't pay their electric bill this month, that might be the thing that triggers them to use again. So for some folks, it's transportation. They want to go to a treatment appointment, but they don't have the ability to get there. Because even in a county like Fairfield, for example, that geographically may not be as big as the whole state of Ohio, for some of our residents, getting from the northern end of our county to the southern end, it might as well be a trip across the United States for them. They just don't have that ability. So being able to provide transportation for those folks or identifying the right resource for them. I said, look, we're really trying to foster a collaboration and provide a different approach to this. And quite frankly, at the very beginning, we didn't know if this would work or not. I didn't care. I said we have to do something differently, and so our group really has been kind of moving forward with that idea. We're behind this concept. We believe in it. We know it's working because we're seeing evidence of that. We have a young man who 7 months ago overdosed, been a lifelong drug addicted person, committing crimes in the community, trafficking in drugs, and quite frankly, 7 months ago should have died when he overdosed. Survived that event. Our Project F.O.R.T team went out, met with him, and he said, it's time. And we got him connected with detox, got him connected with a treatment opportunity. And so 7 months later, that guy, Aaron, he's clean and sober. He's working every day. He's not on public assistance, and he's helping other people with that same affliction connect with treatment and recovery options. And so to see that success, and for officers, police officers, to see somebody like Aaron, because I think sometimes there are a couple things. We go out and do this drug enforcement work, and we go out and arrest these folks, and then we really don't know what the outcome is for that person. Either they end up incarcerated and we don't see them for several years, or they get out, they overdose. We just don't know. We don't see those outcomes, and we certainly don't see those positive things that occur. Generally, if law enforcement's involved, we're seeing the negative effects. So to see this positive outcome of an action that we did that was very different than what we traditionally do has been unbelievably rewarding.